Remember when yung elderly population kasi they're more at risk because of these factors. As people get much older, they acquire more diseases. So more diseases means uh, more medications. Diseases like diabetes, hypertension, heart disease, strokes, and cancers, which makes this population more vulnerable to get certain infections. For them, the infection is a simple one. Usually, it's a more severe one na may prolonged hospital course. And remember, this population is common to have other diseases like dementia, Alzheimer's disease. So it's much more difficult to manage them. So yes, the answer is yes, they're at risk and they still have to stay at home and practice social distancing. We have to also realize this elderly population must predispose sila to certain conditions like depression. Just to distinguish depression in the young versus depression in the elderly. So if depression in the young, nakipaghiwalay yung nobya mo sa'yo, you go to the doctor, Doc, I'm sad, nakipaghiwalay yung nobya ko sa akin. In the elderly, it presents differently. When they're sad because they lost a loved one, or they have some failure in their lives, it presents differently. They don't feel that they're sad. Mapapansin na lang ng mga kamag-anak na they eat less. Some would eat more, but most of them would eat less to a point that they're losing weight. Some would have problems in sleep. Either they oversleep or they undersleep. Matutulog ng maaga, magigising ng madaling araw, then they have a hard time sleeping again. Some of them have problems with concentration. They're reading the newspaper or watching the television. After watching Ang Probinsyano, you ask them, ano napanood mo? They cannot remember. So akala mo, nag-uulyanin na may dementia sila. But the problem there is they just have depression na their attention span was poor. They couldn't remember what they were watching. It's very important to make sure that our elderly loved ones at home don't have some of these signs of depression kasi it's medyo common. All of us were not used to being locked inside the house. And for somebody who's used to going out on a regular basis, shopping, namamalengke, malaking strain to kasi more than 2 months silang nakakulong lang sa bahay. These populations are our loved ones. We have to always communicate with them and make sure we find time to speak with them and their grandchildren. Maybe if they live with their grandchildren in the same roof, they have more frequent interactions with their grandchildren. And most importantly, you have to reassure them of what's going on and that they'll be okay and they're taken care of. So yung depression, gusto ko lang i-point out yan kasi most of the time, tatawag sila and their symptoms is problema sa pagtulog or problema sa appetite or mas irritable or if they have some form of dementia, mga mild dementia, mas nagiging agitated yung pasyente, yung reklamo ng kamag-anak. Other than that, yung mga usual things like high blood pressure, sometimes siguro the diet during this lockdown is not the optimal one. Puro delata yung kinakain natin, maalat. Maybe that's a risk factor for the blood pressure going up. Yung choices of foods natin, it's no longer as fresh as what we used to eat. And those may be our factors kung bakit medyo mahirap i-control yung mga ganun minsan, mga blood pressure, mga sugars sa mga diabetes, sa mga pasyente may diabetes.